Good morning, everybody. Thank you for coming and showing your interest in the profession of dental health or dentistry. Yesterday, someone was here from dental hygiene, and I think they were expecting a dentist from what Joan had mentioned, but I'm the dentist, and we're going to be talking a little bit about the profession of dentistry. I'll carry you through some information, and at the end, if you have any questions, please feel free to entertain those afterwards. So I like to make this presentation a little bit more fun and less dry and boring, so hopefully you'll find it reasonable. When it comes to dentistry, my name's Dr. Ken Hammond. I graduated in 1988 from the Faculty of Dentistry. I did my 3 years prior to dentistry at the University of Manitoba for my Bachelor of Science. And if you guys have any questions afterwards, please feel free to give me email, and I'll do my best to answer it. You can go on our website. There's a whole bunch of information on our website, which is at the bottom there, smiles-smiles.com. So from dentistry, I did a residency in the University of Saskatchewan at the Royal University Hospital, and I did a one-year hospital residency there. And then I came back here and I started working at the Campus Dental Center, which is the university campus. There's a dental office right on the campus. I had no idea there was a dental office there, even when I was in dental school. So I started working there, and then we opened up a clinic called Reflections Dental Health Center. Some of you guys might be aware of it. It's on Pembina Highway, just by the Jubilee Underpass. Has anybody been to the Bridge Drive-In for ice cream? Okay, if you know where that is, we're kind of close by. So anytime someone has sensitivity to ice cream in their tooth, they come screaming to us. So great location. That office was opened in 2003. And my vision and passion in dentistry, I wanted to provide Winnipeg and even Canada with state-of-the-art technology. So if you walked into that in 2003, you'd be walking into the future of dentistry. And that clinic was featured in a magazine that goes to every dental office in Canada as being one of the most prestigious and technologically advanced clinics in Canada. You're always open, and the invitation's there if you ever want to come by and take a tour of the facility. It's quite something. From Reflections, I also teach at the school. So I've been teaching there 1 day a week for the last 18 years. So my education doesn't stop when I graduated. It continues on every day. So let's carry forward. If you guys want to move to the front, we got some prizes and stuff like that. And if you're sitting at the back, it might be kind of tough to hear you, to give you guys your prizes. But we're going to have a little bit of a trivia stuff as we go through as well. So these guys in the front, almost guaranteed you guys are going to get a prize. But you guys will really have to scream loud at the back. So this is our office. You may recognize the logo if you're driving down Pembina Highway by Jubilee. It's Winnipeg, right? Everybody likes something free, so come up to the front. So this is our facility on the university campus, or on Pembina Highway. Our other office is right in the university center. So anytime you wonder about going into a profession, you kind of want to find out what the definition is. So if you were to look at the definition of dentistry in the dictionary, it would say it's the branch of medicine that's involved in the study, diagnosis, prevention, and treatment of diseases and conditions of the oral cavity and the impact on the human body. Now that's big because recently a lot of the research has poured into the fact that the oral cavity is the gateway to the rest of the body. Everything you put in your mouth affects how your body functions, how the organs function, and how your health is determined down the road. In particular, the study looks at the gum disease process, gingivitis. Has anybody ever heard of gingivitis? I think anybody that watches TV would have heard of gingivitis, right? They're always talking about gingivitis and toothpaste and things to prevent it. So the gum disease is something that ends up increasing your risk of diabetes, heart disease, and preterm babies. So women who are pregnant, if they have gum disease, their risk of having a preterm or a low birth baby increases dramatically. So when it comes to the oral health, a lot of times they think, well, I'm pregnant, my gums are bleeding a little bit, I don't have time to go to the dentist. That's probably the most important time that they seek dental care. And the history of dentistry goes way back. When they looked in those little caves and saw these drawings and stuff on the wall, it went back to 7,000 BC. So that's quite a long time ago. And the first dental school, though, they didn't have dental schools back then, obviously, but the first dental school was in 1840 in Baltimore, Maryland. That was the first dental school in North America. If you looked up what dentistry is about, Googled it, you'd see that there's a lot of specialties that come out of dental education. And one is public health, which is a lot of prevention. One is endodontics. Does anybody know what endodontics is? This is the first prize time. Endodontics? No? Okay. So, what's that? I heard it, I think. What's that? And I think someone kind of said end of the root. Is that what they said? Okay, well, endodontics is root canals. And everybody's heard of, oh my God, it was so hard, it was harder than getting a root canal. Right? Or, oh, that hurt more than a root canal. So endodontics is a specialty of root canal therapy. Oral and maxillofacial surgery. Has anybody here had their wisdom teeth looked at? Anybody had them out? Okay. So that's something, probably 80% of the people here will end up having their wisdom teeth out at some time during their life. Radiology is pretty self-explanatory, I think. That's basically the study of the x-rays. Oral pathology deals with oral cancer, areas in the mouth that have problems. And what's orthodontics? This is an easy one. Braces, excellent. Okay, come up and get your Jets toothbrush. These are exclusive. They're one of a kind. We've got a couple of them here. Okay. So who has braces here? Okay, you've had them before? Okay, so it's surprising. Years ago, braces, 30 years ago, not many people had braces. Nowadays, it's almost like a fad, right? Kids come in, adults come in, say, hey, I want braces. And we go, well, how come? Well, my friend has them, and it's kind of cool. And it's like, oh, okay, well, you don't really need braces, so sorry. That's not going to happen. So orthodontics is a really growing field, because now, how many of you guys have heard of Invisalign? Right? It's all over if you listen to the radio or anything like that. And they are basically braceless braces. So they move the teeth with aligners, which are little plastic custom-made trays that you wear day and night, and it basically puts a little pressure on the teeth and it slowly moves them. Pediatrics, what's that? Okay, you already got your prize, so come up. Jets toothbrush, pediatrics. So that's the treatment of kids. So usually by the time someone's 18 and older, they have to move on. But I had to go see a pediatric dentist because my baby teeth weren't the best. And I think it was probably more because I was a little bit of a management issue. So the dentist really didn't have a good time trying to treat me, so they usually slough those bad kids off to the pediatric dentist sometimes. And that's why I went. Periodontics. What's periodontics? Anybody? Oh, excellent, gums. Okay, you can come up. She's got your 2 prizes there. So, yeah, gums, gum disease, gum surgery. A lot of these specialties, after you graduate from dentistry, you go on and you specialize. Prosthodontics is crown and bridge. Crowns, bridges, and then there's general dentistry. Now, there's other dental niches out there. Things that dentists kind of subspecialize in, or they want to direct their attention towards treating those conditions. And one of them is cosmetic dentistry, which is huge. Everybody wants a nice smile, straight teeth, white teeth. That's something that in North America is a very, very high respected appearance. If you go overseas, if you go to England or sometimes over to China, that's not as big of a deal because the culture hasn't directed them towards that. But we are so conscious of appearances in North America, it's driven the industry. Dental implants, how many of you guys have heard of dental implants? Any of you guys have dental implants? Okay, so I mean, it's huge. And here's a really neat bit of information. They've been around since 1964. They've been around a long, long time, but a lot of people think it's something new. And there was a dentist here at the University of Manitoba who patented a design of an implant that basically revolutionized where dental implants went. His name was Dr. Nisnik. So his design of the implant, basically companies said, we love this design, we want to use it. So for every dental implant that was placed, Nisnik would get a check for $100. And we're not talking 10 implants a year in North America. We're talking thousands of implants every single year. And now it's up to over 1 million implants they do every year. Now that patent's run out because it's been a certain length of time. But just imagine getting $100 for every little person that got this procedure. Like the guys that do apps, right? They get 80% of whatever the app costs from Apple. So if you have an app and it's 99 cents and you developed it, you get 80 cents every time someone clicks on and downloads that app, and Apple keeps 20 cents out of that. So it really, really is something that adds up. Oral facial pain and TM disorders, temporomandibular disorders, that's the joint right here. And then there's sports dentistry. Now, why is sports dentistry so big in Winnipeg? Right? Yeah, I mean, when you look at where things are at, they're saying that Winnipeg's going to be one of the first cities in North America to have sellouts for hockey, football, and baseball. All three of those things. You can go get your prize from her. All right. Go Jets, go. All right, time for a little Jets trivia. Anybody been to any Jets games this year? All right. Okay. So this is an open-ended question for another Jets toothbrush. You guys ready? Put your thinking caps on. There is most goals by a Winnipeg Jet this year to date. Right, okay, come up, Jets toothbrush. And who leads the team in the most points? Blake Wheeler, all right. There's two Jets fans sitting right beside each other. Blake Wheeler, most points. Evander Kane, most goals. All right, let's look at what place are the Winnipeg Jets going to be? What place are they in right now? 10th, you got it. Now, here's the other follow-up question. You don't get your prize unless you get this one right. All right. The Jets are in 10th position right now. They got 2 games remaining, one tonight and one Saturday. If they win both those games, what place will they be in? No. 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 Who said it? Who said 10th? Did you? No, you didn't. Okay, come up and get it. Actually, you get it. You come up and get 2 toothbrushes. One for you that got 10th right now. If they win the next 2 games, they still stay in 10th. Okay, come up. All right, good job, you guys. Okay, now I wanted to be fair to everybody. Not everybody is a sports fanatic, so when it comes down to getting questions correct, there is an opportunity for other people to get these answers. One of the other niches in today's day and age is something that affects over 90 million Americans a year at one time or another. Well, that's true, probably, cavities. But the question is, does anybody know what halitosis is? At the back there? Right. Halitosis is bad breath. And some people say bad breath is better than no breath at all. Okay, you can, this lady at the back here will give you your prizes. You can give her one of each. Yeah, so one is actually, it's kind of cool. It's a little marketing thing. It's a business card that has 15 yards of floss in it. So the floss is actually in the business card, which is cool because most people, 15 yards, for most people, 15 yards is pretty well almost a year's supply or a lifetime supply for some people. So halitosis diagnosis and treatment is something that is pretty new because they always used to think infection of the gums was the reason people had bad breath. And that's solely what they thought. So these patients had a chronic problem where it wasn't diagnosed and they didn't know what to do, had nowhere to turn. So back in 1992, I went to Belgium and I went and I did a course with some of the leading experts in the field, and we brought back this halimeter, which is a piece of diagnostic equipment that was developed by NASA to go on the space shuttle to detect gases up in space. And what it did was it detected volatile sulfur gases, really stinky gases, poisonous gases, basically, if it was too high. So this sulfide monitor was something that I used and I studied and I helped people with. And it's something that was featured in the Winnipeg Free Press in 1995, and it was also featured on CNN headline news. So here's how the story went. They came in and they did a little shot, and then they also had something on the TV, CTV News, 5 o'clock news. Next day, I went into the clinic, and the phone was going off the hook. We had calls after calls after calls, and the receptionist is going, what is going on? I got a call from Georgia, I got a call from Pittsburgh, I got a call from California, and she asked these people, like, why are you calling? And they said, well, we saw this dentist who had this specialized equipment to help me. And she goes, well, where did you see it? And they said, it's on CNN headline news. Every half hour, they were running this little 1-minute clip. And everybody who called our office, my name wasn't up there. They had to phone the Canadian Dental Association, and they had to phone the Manitoba Dental Association, and they had to give out the number to 3 different people before they finally contacted our office. So out of the 40 or 50 calls, there was probably 400 or 500 people that had wanted information on it. So that's a niche that is something that is kind of subspecialized. But the great thing about dentistry is technology is always changing. So there's always pieces of technology that you can grasp onto and say, hey, I think this is a great idea, and I think it's going to make a captive audience in the sense that I can treat a lot of people for conditions that other people can't. So one of the things that became more popular is, here in this cartoon it says, psst, hey, Reach, what's that? Looks like some kind of mutant toothbrush or something. And it's like, yeah, the only thing it really looks like I've ever seen is like an eyelash cleaner. So does anybody know what this is? Right, tongue scraper. And so you see those things in Walmart and different stores and stuff like that. And what it does is it cleans the bacteria off your tongue. When you go into a dental office, you're going to see a lot of different people. And when you go in, you're going to some of these people that you see, they may not have a title or you don't know what they're doing, but you're always going to be working in dentistry with a dental assistant. And they're your key player. You may be the quarterback, but they're the receiver. They're the one that goes and points you in the right direction of where to throw the ball. The hygienists, those are people, individuals in the office that end up taking care of hygiene services like cleaning. That's someone they recommend you see on a regular basis. Now, what are technicians? What would a technician do as part of the dental team? Pardon me? On the equipment? Yeah, so you've got equipment technicians. I'm thinking more dental-oriented. What would they make for you? Yeah, molds and implants. Who said implants? Did you already get a prize? Okay, this lady will give you your prize. He's been trying, man. He's answered, I think, every single question, but I've just missed it. Yeah, so they end up making your athletic mouth guards. They end up making your crowns, your bridges, your implants. They deal with all the stuff that we send to the lab, impressions, like this guy said. Sterilization coordinator. That's someone who, in today's day and age, as clinics get bigger and as sterilization and infection control become more of a mainstay, some offices, we have one who's a sterilization coordinator. That's all she does is deals with all the sterilization and all the information that needs to go with that. Treatment coordinators are people that help, it's self-explanatory, the treatment of the patient. And then in 2003, when we opened up Reflections, how many of you guys have gone into a hotel and you check in at the front desk with your family and you want to go to an event or you want to be taken care of, someone that you can ask questions to and they'll generally point you in the right direction. In a hotel, what do you call that person? Right. Oh, God, I don't have that many prizes. Concierge. So one of the things I wanted to do when we opened Reflections is have someone that would greet the patient with a great smile and assist them, get them a coffee, a juice, take their coat, let them know how long it's going to be, pick out their station if they want to listen to something, give them an iPad if they want to play with that, or a computer, something they can check their email with. So that's what we have at our office, and you'll start to see that more often than not in clinics, more so in the U.S. So technology. Technology really drives medicine. Technology drives dentistry. Technology drives any profession that you choose. It's always going to be changing. There's always going to be a learning curve. There's always going to be something new out there. So in today's day and age, what do you think is one of the most asked for services in dentistry today? Oh, bang on, teeth whitening. Exactly. Oh, she wants a prize. Any prizes left? Oh, yes. Perfect. Yes, teeth whitening. So that's the number one reason a lot of people come in, and it's usually a time constraint. I've got a wedding coming up, grade 12 grad, whatever it is. And so teeth whitening is one of the most sought-after services. So that's why these companies out there are really driving the force and marketing towards appearance. So how many here have ever tried any whitening, like whitening toothpaste, Crest white strips, anything like that? You guys can be honest, like no one's looking at you. And I don't think he's videotaping who's putting up their hands, right? I mean, there's lots of people out there that have looked into it. So you've got Crest white strips, the whitening toothpaste, which don't really do anything, but every toothpaste company out there has to have a whitening toothpaste because everybody else does, right? Colgate, gel whitening, and then they even have the marketing of putting whitening products in mouthwash that's supposed to enhance things. All those things are good, maybe testers, if you want to call it that. Some work, some don't. I mean, if you were to do something that's cost-effective, and I always tell my patients, if they want to try something, go out and try Crest white strips or Colgate gel or something. At least it'll give you something. When it comes to the dentist, as a professional, anything that you give a patient has to have some research behind it, and it has to work. Because legally, you're liable for anything that you are doing on a patient. So the two mainstays with regards to whitening on a professional basis involve take-home whitening, where they make some custom trays and they give you some whitening gel, and you basically wear it for a couple of weeks, or you wear it for a few hours a day, or you wear it as a touch-up, or laser zoom advanced whitening. And there's all this drive. Like I was in Vancouver 2 weeks ago, and they had this little light, and they were showing people, you know, come in and sit down for 15 minutes, and we'll whiten your teeth. And you see them in the shopping malls and stuff like that. Now, the light is more of a show in that atmosphere. In a dentist's office, there's usually a gel that's put on the face and along the gums. So if you're using a high-intensity light to assist in the whitening, it's not something that can be done in a shopping mall by an assistant. It has to be someone who's trained in that. The other technology that's out there that's really probably new in the last 10 years is laser dentistry. And what they do is you can use a laser to do surgery. You can do a laser to do fillings. And the great thing with it, you don't need a needle and you don't need a drill. Digital radiology uses, a lot of the hospitals are doing digital x-rays, and the reason is because they can, just like a digital camera, change the view and see it better, and they don't have to necessarily just be married to one image. And the other big thing is it decreases the radiation by 80 to 90%. 3D scans is like a CAT scan, and they do that a lot for implants. They can do a scanned impression. Remember Dave was talking about that gooey stuff they put in their mouth and it hardens and then they pry your mouth apart to get it out? Anybody had that? Impressions? Never? They aren't that bad. But now they can actually take a picture of your mouth, email it to a company, and they can make a crown on that image. Or they can make study casts of your teeth just from that scanned impression. So that's amazing stuff. As well, from scanned impressions, you can buy a machine and do crowns in an hour right in your office. So you can go ahead, take an image of the tooth, plug it into the computer, and it takes a piece of porcelain and it mills out a crown. And in 1 hour, you're not having to wait 2 weeks like Dave Letterman was. You can have this crown and have it cemented the same day. Sedation dentistry. Sedation dentistry is huge because it brings in people that have had a bad experience in the past and they're scared to go to the dentist. Maybe not you guys, but years ago, there wasn't the technology and the techniques that they have today. So there's lots of people out there that are nervous about going to the dentist. So sedation dentistry, what it does is it allows the person to get their dentistry done when they're asleep or when they're in a more relaxed environment. So they come in, they get a pill under their tongue for 45 minutes. They're basically awake, they can move around, walk around, but their anxiety level goes way down, so they're not nervous anymore. And immediate implants. When someone knocks out a tooth in our office, if it's a front tooth, they don't want to walk around with a gap in their mouth. So nowadays, what we can do is we can actually put an implant in the same day and have a temporary crown. So they come in with no tooth and they leave with one tooth. So a lot of people ask me, as an educator or a dentist, you know, what's the key to success? And I think if you guys asked parents or friends or aunts or uncles, a lot of people would give you the same answer. So let's throw this out there. What do you think some of the keys to success are? This isn't a prize question, but what do you think? Hard work, yeah, that's one. What else? Determination, excellent. What else? Perseverance, excellent. What else? Just scream it out. There's no wrong answers. Love, education, excellent. So, in my opinion, I think that probably one of the main ones is what was said already, education. I've taught at the school for 18 years, and a lot of times people think they graduate from dentistry and that's it, they're done. It's over. They don't have to take another class, they don't have to write another test, they don't have to worry about studying anymore. But education equals success. And as things change, you're always going to be educating yourself, no matter what field you're in. And in the office, as a dentist, it's not just educating yourself, you've got to educate the patients. You've got to make sure the patients have the information so that they can make an informed decision, and the correct decision. You're helping guide them toward quality of life. So there's always choices and informed consent. And so when it comes down to educating people, you can give them pamphlets, show them pictures, show them models, show them videos. Tons of people now, if you've got a question, where do you find the answer? Right, Google. Like, that's the #1 resource nowadays. People go to the internet and they Google it. And so sometimes you got to be careful because you got to look at what sites you're looking at. It may not be correct information and it may not be accurate information, but it's still something that everybody does today. So that's our office on Pembina Highway. You're more than welcome to come by if you want for a tour. If you want to email me, you can. Or the other thing is, if you have a dentist, ask the dentist if you can shadow them. This was taken a couple of days ago. This is Dr. Ryan Sang and his assistant, and this is someone that is in first-year university, and they're looking at dentistry as an option as in the profession. So dentistry is a great profession. Everybody, I think, is pretty open if you wanted to spend a few hours and just kind of shadow things. They might kind of select what procedure you're going to watch, but it's something that may give you a better idea whether or not that's something you're interested in. And also, the number one reason for success is you want to provide comfort and service in any industry. So as a dentist, you just remember, once you become a dentist, you can either be an associate, you can be an owner of your own office, you can specialize, you can go on and teach at the dental school, you can do research, you can work up north. There's so many options, whether it's dentistry or medicine, but dentistry is something that's always changing, and you've got tons of flexibility on where you work in the world. I find I've got a huge passion for dentistry. It's fun, exciting, and you're always learning and meeting great people. Everybody's got a great story, good or bad, but you share knowledge and you share relationships. And as I said, I would really highly recommend that you shadow or ask others who are in the profession, the hygienist, next time you go get your teeth cleaned. You know, ask them to share some information about what they do and what they find is rewarding in that field. And as a professional, no matter what you choose, the future is always going to be bright. So I just want to thank everybody. I'm just going to close on this. This is Smiles for Life is something that when I talk about things that you can do, this is our 12th year, and what we end up doing is we did a fundraiser every year where we do whitening, because that's a big thing, and all the money goes to children's charities. So this is something that, I don't know if you guys ever heard of Bill Dorfman. He was on the makeover shows and stuff like that down in California. So he owns Discus Dental, which is a big whitening company, and he he gave free products to dentists who wanted to participate in this program. But it's something that allows people to do whitening. They do it for less money, and all the money goes to charities. So it's a great program that they run and we run. So thank you very much.